Welcome. Thank you so much for joining us for this virtual presentation. My name is Sarah Seward. I am a pharmacist analyst at Children's Wisconsin Hospital in Milwaukee, Wisconsin. Eric, if you want to introduce yourself.
Thank you. Hi, my name is Eric Augustine. I am also a pharmacist analyst on our Epic Willow team at Children's Wisconsin.
And today we're going to be presenting on the topic of crossing into tomorrow, embracing emerging technologies in pharmacy. While we do not have any financial relationships to disclose, we will be mentioning several companies or brands of technologies by name just to illustrate some examples. Our mandatory AI statement. So we did use ChatGPT and Google AI as tools to help organize and facilitate construction of the presentation. And then our learning objectives. So we have 3 learning objectives for you. Number 1, describe at least 3 current and 2 emerging technologies in pharmacy and healthcare, such as artificial intelligence, clinical decision support tools, and telepharmacy. Number 2, explain how current and emerging technologies in pharmacy contribute to improving patient outcomes. And number 3, analyze the benefits and limitations of current digital health solutions, such as mobile health apps and wearable technologies. So we wanted to begin with a quick look back into the journey of pharmacy as a profession to really understand how far we've come. The history of American pharmacy in the modern era can be divided into the 4 time periods you see here. In the soda fountain era of the 1920s to 1940s, pharmacy's primary purpose was focused on dispensing. In the lick, stick, pour, and more era of the 1950s to the 1970s, pharmacy gravitated more towards patient-focused services, and early automation systems began to appear during this time. In the pharmaceutical care era of the 1980s to the early 2000s, development of formal postgraduate residency training focused on patient care across the continuum of community and hospital-based pharmacy settings. This, combined with the transition to the PharmD, became the entry-level degree, helped to create a strong foundation for the expanded delivery of patient care services in pharmacy. The declaration of pharmacy as a clinical profession at the 1985 Hilton Head Conference boosted the profession and helped expand pharmacists' pharmaceutical care duties to include things like resolving drug-related problems, collaborating with other healthcare professionals, and overall promoting patient well-being. In the post-pharmaceutical care era, beginning in the 2010s, opportunities to improve medication-related quality measures and decreasing total cost of care became the prime interest. Now considered key members of the healthcare team, pharmacists are uniquely positioned on that continuum of patient care to help provide direct patient care through things like medication management, immunizations, and chronic disease care services. The next step in fostering positive health outcomes is to enhance our connections with our patients through technological innovations to expand our capacity for direct patient care. So let's dive further into what both current and emerging pharmacy technologies look like. So we've listed many forms of current pharmacy technologies here. Hopefully, many of these will look familiar to you. We will dive into a few examples, but first we need to level set on some of the differences between an interfaced and an integrated technology system in order to understand how this can impact performance and maintenance of these types of technologies. So an interfaced system is one in which 2 or more separate software products communicate under limited capacity with each other. So for example, a electronic medical record and a third-party smart pump. An advantage of utilizing interfaced softwares is that this can promote more competition in technology development. However, the biggest con to utilizing this type of software is that it can create possible communication problems. There is an international standard to exchanging electronic health information called HL7 or Health Level 7 that is used to try and mitigate this. However, errors can still occur. An integrated system, on the other hand, is often the preferred choice as the technology functions as one system. So for example, an integrated functionality like the lab module and a pharmacy module within the electronic medical record software. The biggest advantage and disadvantage of an integrated system is that it is one system. It can be much easier to get the different areas to communicate because it is one system. But at the same time, if problems arise within one module, it can often impact the whole system, causing potential issues with downtime. So now I'm going to pass it off to Eric to help us dive deeper into some examples of current pharmacy technologies.
Thank you, Sarah. I'm going to introduce some examples of current technology that we all may see during our daily workflows. Keep in mind, though, that most of these current technologies still require some sort of human intervention to function, for example, a person to computer type of interface. TPN, or total parenteral nutrition, allows pharmacies to compound complex solutions quickly and accurately. Through a computer interface, a compound can be entered by a pharmacist, and then that compound is sent over to the compounder, in which the pharmacy technician can then compound the product. There are still some who might remember that back in the day, each TPN ingredient was drawn up by hand in order to compound a TPN itself. Now, with this current technology that is likely in use widespread, we can enhance efficiency and safety through compounding. Filling robots are used both in the inpatient and outpatient setting. On the screen are examples of each. On the right, you have a outpatient robot, and on the left, you have an inpatient robot. While outpatient filling robots may be more common than inpatient robots, they both exist to enhance efficiency and accuracy by dispensing accurate medications quickly after they have been entered into a computer. High-speed medication packagers are mainly used in an inpatient setting to repackage bulk bottles into individual doses, rather than a manual process of repackaging each tablet individually into smaller bags. Repeating the theme here, a human still needs to intervene and run this system. However, if that is run appropriately, the efficiency of packaging is achieved and also patient safety is improved. Continuing along the theme about robot and dispensing technologies, we have ADCs, or automated dispensing cabinets. You sometimes can hear them referred to as ADSs, or automated dispensing systems. These greatly enhance medication to patient workflows and reduce errors and increase efficiency. Common examples that many of us may see in our daily workflows are vendors such as Omnicell, MedSelect, or Pyxis. While not fully error-proof, these current technologies allow for efficient medication dispensing and allow for quicker interventions if patients need them. Carousel storage systems are mainly seen in the inpatient setting, although they can be used in the outpatient setting as well. This technology helps increase the efficiency of stocking our automated dispensing cabinets, as well as assist pharmacy with inventory management. This can be accomplished by setting reordering levels, as well as keeping track of current on-demand inventory that is updated as items are added or removed. This allows for a pharmacy to run efficiently and not run out of medications by using computers to automatically reorder and automatically stock where supply is needed. Automated lockers are being used, but in a smaller capacity. You'll see in the middle bottom there is an Amazon locker, and that is similar to how the pharmacy lockers are being used. Amazon has set up automated lockers to facilitate package procurement by an end user, and outpatient pharmacies can utilize these lockers to allow patients to pick up their medications during non-operational hours, as long as all lawful dispensing requirements regarding counseling have been completed. This improves patient access and allows for more convenient pickup of medications when necessary. Now moving on to more remote and virtual workflows that are still current but starting to emerge into our field. Remote counseling and telemedicine can kind of be grouped together. Remote counseling, I think of it, pertains mostly to pharmacy, whereas telemedicine pertains mostly to providers conducting medical visits. Utilizing a video conferencing software, current technologies have increased access to healthcare providers. Video conferencing allows for more remote workflows and increases outreach. I personally have had an experience with remote counseling where a pharmacist was able to actually verify a fill in a remote pharmacy, but then also provide remote counseling and answer any questions that are needed. This can definitely increase outreach in more rural areas and allows for a pharmacist to take charge of multiple pharmacies at once. Remote verification mainly is applied to IV workflow solutions. Many different softwares now have the ability for pictures to be taken during compounding in an IV room, and the pharmacist can verify the compounded product remotely. This also helps eliminate some less ideal methods for denoting compounding, such as the syringe pullback method, which has led to errors which many people are probably accustomed to. By taking pictures and documenting those workflows, pharmacists and technicians can have more confidence in the products that they have compounded. Finally, we're going to move on to some biomedical technologies that are currently in practice. RFID or radio frequency identification is currently used in various capacities. There is a term of active versus passive tracking with RFID, whereas active tracking refers to real-time tracking as it passes a sensor versus passive tracking in which a scan must be initiated to read the information. Current RFID uses that I can think of right now are using it for lot and expiration tracking to allow for fast intervention in case of medication recalls to avoid any patient harm. When we're talking about smart pumps, we now switch more to a computer to computer interface. While there still is some sort of human intervention, the smart pump is usually talking to an electronic healthcare record to provide various information. Current smart pump technology allows for information to flow bidirectionally to enhance patient safety and improve efficiency. Also, with smart pumps, we can add safeguards so we can effectively ensure medication delivery via hard upper limits or hard lower limits to ensure that the medication is infused appropriately and isn't going above or below our acceptable limits. In terms of another form of smart pump, we can think about an insulin pump as a wearable device, and that introduces another class of not only current technologies, but we will revisit this in our emerging technologies section as well. In terms of current technologies, smart insulin pumps allow for patient-centric administration of a high-risk product. While there is human intervention required to operate this, the delivery is still optimized and allows for a high-risk medication to be delivered appropriately to a patient. As far as current technologies and how they're improving patient outcomes, we all know that patient safety is at the center of our approach. Patient safety has been greatly improved with our current technologies, mainly with barcode scanning. This allows pharmacy to pick medications properly and also be alerted when the improper medication is picked for dispensing. In cases of using robots for dispensing, it can also help staff dispense the correct medication without the need for manual picking. Improving patient access is also being improved with our current technologies. Having quicker access to a healthcare professional, including a pharmacist, this can increase a patient's confidence in taking charge of their healthcare by asking pointed questions and getting sound answers and advice. A good example could be if someone is experiencing chest pain and wanting to take aspirin. By reaching out with a telehealth visit, it could be identified that the individual may or may not need rapid intervention and can be referred to an emergency care center for immediate care. Finally, we can improve medication delivery and tracking with our current technologies. Smart pumps in the hospital allow for easy programming and safeguards so infusions are more accurately and safely administered. Smart pumps on the wearable device side, specifically insulin pumps, allow patients to accurately dose and deliver medications, similar to the concept of OTC medications and prescription medications. With tracking, we can also track lot and expiration numbers digitally. And again, as I mentioned previously, we can more quickly identify problematic medications and intervene to prevent any harm and rapidly comply with any FDA recalls. And now I'll pass this off to Sarah to talk about our emerging technologies.
Thanks, Eric. So you can see some of the emerging healthcare technologies we would like to touch on listed here. Again, hopefully many of you will recognize some of these, as a lot of them have been in the news and the media and are of prime interest for a lot of organizations. The first one we're going to touch on, and start with is artificial intelligence, or AI. So AI is not simply a if-then robotic process. There are many layers to it. It's more of a spectrum. So this is a visual representation from our EPIC colleagues, helping to kind of visualize that spectrum. You can see why AI is an exciting and emerging technology, as we are taking basic AI and making it smarter as we go. So on the left, we have more targeted or rule-based logic. If X, then Y. Moving to the right, we have predictive analytics. So this helps us to begin to predict specific outcomes based on data. I have this data to pull from. Now I want to see how many people are going to develop asthma. We have a targeted or specific outcome in this case, versus when we move all the way to the right with generative AI, this is more broad or generalized. Generative AI can assist on the inpatient side with something like verification of a medication order, along with summaries of medication history, labs, and interactions that a patient may have experienced. One of the more common examples of this in a non-healthcare setting is AI-assisted chatbots like ChatGPT. So to dive even further into generative AI and what it might be able to help with, at the top, we have the idea of drafting text. So drafting a message as a reply to a provider. Moving clockwise around, we have generative summaries. So for example, inpatient summaries, like a sidebar report as a pharmacist. You're logging in, it's been 24 hours since you've last seen that patient. Show me the summary of what's happened with my patient with labs and vitals during that time. Continuing around, we have translating context. So not translating by language, but translating, hey, take this data and make me a graph out of it. Taking that text and translating it to something that is more discrete. And then finally, we have task automations. So searching for the right information throughout the chart and appropriately drafting answers to, say, a prior authorization form. Tasks in which you would need to find various information in multiple places can now leverage generative AI to pre-fill forms or checklists for review and validation by an end user. Like I said, maybe automating a referral intake form by extracting scanned texts and filling that information in automatically. Generative AI takes plain human language and translates it into computer language, like, I want to see a graph of this. So even though AI is thinking for itself, it still requires human approval or intervention for that next level critical thinking or evaluation. We want to be very clear on what the potential for AI in healthcare is. So AI is a tool to assist in gathering data and patient summaries, helping us to practice at the top of our license. It's helping to increase efficiency through helping with scheduling, lab results, and vitals analysis, and helping to shorten long tasks. It's facilitating access to healthcare by making the patient more connected. What AI is it's not a magical solution. It is not a synonym for automation. It is not a replacement for critical thinking or human intervention, and it is not inherently unbiased. AI systems are trained on data, and if that data reflects existing biases, then the AI will perpetuate them. It's crucial to address biases in data and algorithms to ensure fair and equitable outcomes. So how is this impacting healthcare in a good way? It's making us better caregivers to our patients by increasing our efficiency and allowing us to practice at the top of our license. On the reverse, how is this potentially impacting healthcare in a bad way? Sometimes people can become too reliant on the technology and assume that it is always right. Again, AI is not a replacement for human intervention and critical thinking. We need to be good stewards with its use. Nanomedicine as an overall topic, we're not going to go into too much detail on each of these bullet points here because you can see this category alone is pretty large, but we do want to highlight a few high-level things. So nanomedicine as a whole allows for more precise drug delivery, minimizes systemic exposure, and reduces potential side effects. Nanotechnology can improve the accuracy and sensitivity of diagnostic tests, used to detect various diseases. It can also be used to ensure that drugs reach their intended targets and remain active for longer periods of time. Or it could even improve drug solubility, stability, and specificity by increasing binding potential at the cellular level. One practical example of nanotech's increased binding capacity is when it is partnered with magnetic drug delivery technologies. This concept utilizes the application of external magnet fields to guide drug-loaded nanoparticles to a specific site within the body. By applying a magnetic field externally, the nanoparticles can be directed towards the desired location, such as a tumor, effectively with minimal side effects. This combination of nanotechnology and magnetic drugs, in particular, has shown promise in several areas of medicine, most prominently being chemotherapy. One of the best recent examples of nanomedicine at work was the development and expedited approval of the COVID-19 mRNA vaccines. So nanoparticles, it helped to improve the stability of the vaccine at its core by protecting the encapsulated mRNA from ribonucleases, and it facilitated the delivery of the intact mRNA to the target site. The overwhelming success of the mRNA-based vaccines can be attributed to their unique nanocarrier, or the lipid nanoparticles that you can see depicted here. Ultimately, nanomedicine is one of the best emerging technologies to personalize the healthcare experience moving forward. And I'll hand it back to Eric.
Thank you, Sarah. I'm going to talk about a few more emerging technologies that may have some bigger use in the future and may just be starting to make its way into current workflows. I'm going to first talk about augmented and virtual reality, and specifically, I'm going to focus on augmented reality, or AR. AR mixes digital imagery with the real world seen through a camera. Some non medical examples of AR that you might have seen are Pokemon Go, Snapchat filters, or Amazon placement services, in which you use your phone to see how certain things will fit in your house. These images can be interacted with in real surroundings controlled by the user. Augmented reality AR itself could play a role in pharmacy in the near future. While I'm not aware of any current uses of AR, some theorized uses could be in diabetes education in combination with telemedicine as a way to educate patients on how to inject insulin or how to use certain devices in their home setting. There are some other theorized uses of AR that could potentially be very cool, such as, could AR help prevent any sort of medication errors by identifying look-alike, sound-alike drugs while you're using augmented glasses to pick medications in an outpatient pharmacy, noting that the green circle is the correct medication and the red circle is the incorrect medication because it is a look-alike, sound-alike. Could AR itself help us to identify medications more quickly? Usually we have to use a identifying software and enter the color, shape, and inscription on a tablet in order to be able to identify it. However, could AR be used to identify these medications quickly by just looking at them through augmented glasses? What if AR itself could help identify where medications are in a pharmacy? Most of us who have worked in an outpatient pharmacy know that picking medications off a shelf can be an acquired process and it could take little time or a little bit more time. However, could AR actually help identify these medications quickly, and again, identifying the look-alike, sound-alike medication so that we're picking the appropriate medication? Could AR itself help support pharmacy operations by just looking at the medication itself? It could list the current inventory, the estimated inventory needed, any sort of reminders in terms of special handling with the product or special dispensing procedures. So maybe AR could help in these situations. Again, these are theorized uses and might not be in practice, but this could be a leaping point for pharmacy into the AR realm. As opposed to AR, we have virtual reality, or VR. Virtual reality is a fully virtual world that provides an immersive experience. The experience is likely to require a headset to surround and immerse an individual in an interactive environment. Some real life examples of VR include the Meta headset, any sort of VR gaming or travel experiences and training situations in which everything is a virtual environment. VR has more immediate impact in other medical fields, like for treatment of PTSD and other psychological conditions or training for surgeries. Promising areas for pharmacy could potentially include adjunctive or as a replacement for pharmacotherapy in drug design and discovery, pharmacist education, patient counseling and behavior modification, or other uses. Wearable technologies are likely to play a bigger role in the future of healthcare and pharmacy as well. With pharmacists conducting medication therapy management or MTM in certain areas, wearable technologies can provide additional data to help pharmacists make informed clinical recommendations or decisions. The biggest example of wearable technology that we have right now is the Apple Watch or the Oura Ring. Both provide various health tracking data, and technology keeps improving over time. Some examples of health data tracking that you can see with these devices are EKG monitoring, and this can be linked to provider notifications in terms of if you're in normal sinus rhythm or if you're experiencing some sort of heart arrhythmia. Another way is detecting atrial fibrillation or AFib and getting an alert on your watch that says that you are currently in AFib, and it can actually track that data that you can present to your healthcare provider at a future state so that they can make informed decisions on how long that episode lasted, if it self-terminated, or other information that might help the healthcare provider make an informed decision. Detecting low oxygen levels or SpO2, this was a big consideration that came out of COVID in which people were experiencing low levels of oxygenation. And specific to the Aura Ring, they talk a lot about predicting illness patterns. By reading certain healthcare data, they can track if you're about to get sick and recommend some sort of preventative measures if that is necessary. Along those lines, continuous glucose monitoring devices have also been a big improvement in diabetes management. Well, typically, blood glucose is measured pre and potentially post meal when you're dosing insulin. The ability to see glucose trends continuously not only empowers individuals to take charge of their condition, but also gives providers more data to make informed clinical recommendations or decisions. With wearable technologies, patients can get instant gratification by seeing real time numbers to know that they are taking care of their own health and can see a difference that their medications are potentially making. Currently, you have to go somewhere to get a blood pressure reading to see if your blood pressure medication is doing anything. However, in the future, with these wearable technologies, if they potentially could measure blood pressure, this could give instant gratification and instant notification to the individuals that they are taking charge of their health and their medications are working appropriately. Wearable technologies will continue to vastly improve the objective data available to healthcare professionals. Through passive data collection after initial programming, patients are able to obtain this data and either manually upload or have the device integrate with an electronic health record. This allows for very personalized healthcare and will give a provider more data points to make informed clinical decisions. We can more rapidly identify problematic trends and alert people to seek medical attention for conditions such as AFib, unstable angina, illness, or potentially obstructive sleep apnea. While these processes are still being refined and AI can further enhance this could shape the future of wearable technologies and rapid intervention. While there are many positives to wearable technology, the one limitation is potentially data privacy and security, and it may actually play a role in apprehension in adopting healthcare tracking. HIPAA practices need to be kept in mind when accessing this wide array of data if a patient decides to share their personal healthcare data with us as healthcare professionals. And in terms of emerging technologies, how is it improving our patient outcomes? Well, as I've stated before, we can drastically improve the efficiency of healthcare with emerging technologies. We can use the previous technologies mentioned in various ways. One of them being improvements to documentation. By using AI to craft notes and document findings, we can increase the amount of face time a patient has with a provider and limit the amount of time that we need to spend documenting our findings. The data that comes through wearable technologies can also be documented earlier and allows a pharmacist or physician to prepare recommendations prior to an encounter. With wearable technology specifically, healthcare professionals now have more data to aid in their investigation, diagnosis, and recommendations. Single data points can sometimes present confounding information. However, multiple data points can identify obscure values and improve patient care. Data trends for healthcare factors such as heart rate, blood glucose, blood pressure, and other future data that we identify can help providers make informed choices in managing medications or other aspects of patient care. Also, by having more population data, targeted preventative interventions in specific communities are now possible, as well as using large amounts of patient data to aid healthcare providers worldwide in diagnosing and identifying rare diseases. We are also always improving patient safety. With the potential for AR and VR, there may be potential to improve medication dispensing, specifically in the outpatient settings. The potential examples provided previously would vastly improve proper picking, dispensing, and ordering and stocking. Again, with emerging technologies, we also have to keep in mind the limitations with these technologies. Some limitations include data privacy, as I mentioned before. Having that data out in the public is great. However, it needs to be protected and worked with appropriately. The time and maintenance to set these systems up and also to maintain them could be problematic, but it's not a drawback, or it's not a full drawback. It's just something that we have to keep in mind when we're using these emerging technologies. And then finally, backup systems. We can't be totally reliant on these technologies. We have to have some sort of process in place for when these systems potentially have issues and are not accessible. So, what are those backup systems and how do we work with them? Identifying that limitation and overcoming that will allow us to better adopt these emerging technologies. And I'll finally pass it over to Sarah to wrap up our content.
Thanks, Eric. So to wrap up, we're going to let our nerd flag fly for a moment. Blending of these current and emerging technologies with our patients at the center is the future. We are not Skynet letting technology take over. Instead, we'd like to think of it as we are moving more towards the National Federation of Planets, that amalgamation of ideas and minds from different cultures or backgrounds to lift all of us up and ultimately make us better caregivers to our patients. Implementing these technologies doesn't replace humans in this future patient care world. It's just how are we going to continue to find newer and better ways to augment practice and patient care. So with that, Eric, if you can take us through the learning assessments.
Thank you, Sarah. Now we're going to run through 3 learning assessments from our presentation, and hopefully you can identify the correct answers that are in line with our learning objectives. I'll read the first learning assessment for consideration. Which of the following is not an emerging pharmacy technology? Is it artificial intelligence, augmented reality, filling robots, nanomedicine, or wearable technology? If you would pause prior to the answer being shown, you can take a moment to think about the question yourself. I will now present the answer. The answer is C. Filling robots are currently not an emerging pharmacy technology. They exist in a more widespread current setting versus some other pharmacy technologies that are not widespread and emerging. While wearable technologies is a current technology, it is more an emerging pharmacy technology, and thus we have decided that filling robots are not an example of an emerging pharmacy technology currently. Learning assessment question 2. Which of the following represents how current and emerging technologies in pharmacy are contributing to improve patient outcomes? Is it faster vaccine development and implementation, improving availability of personal healthcare data for rapid intervention, replacing staff with technology is reducing job opportunities, the combination of A and B, or all of the above? Please pause and think about the question for your consideration. The answer here is A and B. Our current and emerging technologies are allowing for faster vaccine development and implementation, and as well as improving the availability of personal healthcare data for rapid intervention. We want to stress that technology is not replacing jobs. It is an augment to staff, not a replacement to staff, increasing efficiency of staff with existing responsibilities in a world where we are increasingly asked to do more with less and are looking for fast intervention. And finally, for learning assessment question 3, what are common limitations of current digital health solutions? Adds additional time and steps to accomplish a task, concerns for data privacy and security, fallibility of technology, the need to have a backup plan in place for downtime, maintenance of technology can be more prohibitive than implementation, or all of the above. Please pause for your consideration, and I will present the answer shortly. The answer here is all of the above. All of the above listed are common limitations, with time and maintenance leading the way. We also need backup systems, as I previously mentioned, when our current technologies have downtime. The biggest limitation, though, to keep in mind is data privacy and security, with more data becoming public in public domains. We want to thank you for listening to our virtual presentation today. We hope you enjoyed this. If there are any questions, our contact information is listed on the slide here, and feel free to reach out with any sort of questions, comments, anything that we can help with. Our references are provided on the next two slides. And then finally, here is the CE code for our presentation for Crossing into Tomorrow, Embracing Emerging Technologies in Pharmacy. Thank you for listening.